as we would expect, young people leading the digital revolution. We'll be hearing from some of them later on in the session today. It is now my pleasure to welcome our expert panel speakers on digital innovations. We have Patrick Sullivan, who is a professor and researcher at the Rollins School of Public Health at Emory University in the US. We have Leo Ogada, who is the program lead at TriggerWise here in Kenya. We have Bolutife Adisa, who is the co-founder of Digital Grassroots. They work with young people to improve digital literacy. And finally, we have Isabel Amazon Brown, a digital service designer who recently worked with UNICEF on creating chatbot safeguarding guidelines. Welcome to you all. Everyone in the audience, please do submit your questions in the chat box as you listen to our expert panel. So I'm going to start off with Professor Sullivan. It would be great to hear from you about some of the latest evidence. What is it telling us about Mhealth interventions and their potential support for HIV and sexual health for adolescents?
Thanks so much. I want to talk a little bit about the what, the how, and the process, and what we're learning in the development and testing of these interventions. In terms of the what, I think it's important that when we ask youth and adolescents, when we ask existing providers what is needed to support good sexual health and HIV prevention, it's not just all about condoms and sort of bits of facts about transmission. It really is making that content age appropriate, but also some basic skills about how to access services. And we hear again and again from youth that it's impossible to separate out these topics from things like dating and social skills and school and studying. And so really addressing the services that we want to encourage in the context of those other settings is important. In terms of the how, there's just such a rich universe of how to interact with adolescents. So videos, and I know we'll hear more about that, the idea of gamification, peer navigators, where we actually train young people to provide navigation services from a peer perspective. We're doing more and more with mailed out commodities, whether that's HIV self-tests, STI tests, or condoms and lubricant. And online discussion forums are another great way to get youth engaged. And in terms of the process, I think we'll talk a bit more about this at the end, but considering adaptation of existing apps that where some of the structure can be kept, but it can be adapted to be more relevant, getting broad input from affected communities, and that includes prevention providers, but also parents, teachers, and public health. And then finally, just theater testing these interventions with key groups and getting feedback about how and when and under what circumstances young people might want to use these interventions. And I think all of these are pathways to developing the most effective, impactful, and useful interventions to the people we're trying to serve.
Great, thank you. A wonderful starting point for us in this panel discussion today. I really appreciate the different aspects and also the co-design aspects as well that you were mentioning, really important. So I want to now turn to Leah. We've heard a little bit about what the research is saying, but I want to take us now to the implementation perspective. So Leah, through TICO and other platforms, we hear that TriggerWise is reaching over 600,000 young people in East and Southern Africa. Very impressive. Can you tell us a little bit more about the approach that you're using?
Thanks for that. So TriggerWise has been able to reach more than 600,000 girls who've signed up onto the ITH platform, of which 400,000 girls have already accessed teenage-friendly sexual and reproductive health and HIV services. In order to generate impact, we use funding revenue to issue payments and rewards, facilitating service delivery to end users through a disruptive sexual and reproductive health and HIV service provider network of pharmacies and clinics, where we are encouraging greater competition and innovation in supply. So in every ecosystem, which is a 5-kilometer radius within a targeted administrative ward, we onboard at least 2 clinics, 1 pharmacy, 5 retailers, and 5 mobilizers, and to be able to support the enrollment and service delivery of these young girls. The platform supports the actors by using behavioral nudges and incentives targeting adolescents and youth with unmet needs within the targeted subsidies. We use subsidies to motivate girls to make these life-changing health decisions. The real-time data that's generated on the platform supports rapid prototyping and iterations, aside from utilizing the platform data to observe behavior and manage performance in comparison with the health management records collected within these facilities. Users, who are the girls themselves, are able to provide us with feedback through rating. So they do give us rating for all phone users, and we are able to also obtain feedback from those who are not having phones through client exit interviews. And we use this to be able to improve the quality of services within the facility. And also it allows us to continuously optimize our offering on the platform.
Wow, that sounds really like you're both improving being successful in the demand, but also in the supply as well. That's really exciting. I want to now turn to Isabel. You've been working with digital platforms for young people for over a decade now. And no doubt you're aware of some of the great successes like we've just heard around Trigger Eyes, but also some of the potential downsides. So in your recent work on chatbots, what are some of the safeguarding and ethical considerations that developers and implementers really should be aware of?
Thanks, Alice, and thanks for having me. Before I start, I think it's always helpful to give a brief definition of what we mean by chatbots, because it's a relatively new technology and people can have different understanding of what that means. So roughly speaking, it's a computer program which most of the time will run on people's phones, but it can also run on other devices or web browsers, which simulates a conversation. So it basically makes people believe that they're having a conversation with a user. But the biggest ethical challenge with that when working with something like chatbots is to acknowledge that by their very nature, we're inviting teenagers to believe that they're being offered a one-on-one personalized service, and that's the whole intention, is for it to be conversational, for it to feel human. And in fact, most of the time, they are not, and they're not actually sort of adequate enough quite often to really provide the same level of service that, an individual could. And really the challenge there is that they don't often do quite a good enough job at providing precise answers to people's questions, even though in the way we advertise these services, that is the promise that we're making. We're saying to young people, do you have questions that go unanswered elsewhere, or that you're too shy to talk about with your peers or with your elders? Come and ask them and we'll give you answers. So the sort of first ethical risk is really about how appropriate those answers are, whether the user gets an answer at all when we've kind of promised them something and we don't deliver. Or the risk that we might incur if we provide an answer that's maybe not relevant or accurate enough. So in a sense, that's a sort of a risk that we will take when providing any type of digital service online, obviously. And actually, it's a risk we take with face-to-face interactions as well, because they're not flawless, obviously. But I think it's that premise that we're offering, which is probably the most sort of challenging aspect. And on top of that is that if a chatbot actually does do a really good job at coming across in a sort of really human way, and you kind of, allow the user to suspend their disbelief that they are actually talking to something with human-like qualities, even if they might be aware it's a chatbot, whether or not the service is adapted to do so, or the intention of the service is to provide support with maybe more serious issues, it's very common, as any digital provider will tell you, for users to start disclosing actually extremely traumatic or potentially life-threatening experiences or situations that they're going through. And so those might include instances of gender-based violence, but they could also include things like suicidal ideation. And so the harm that we cause if we're providing this service that kind of purports to provide, a one-on-one support and to kind of be there for the user, if we don't have the sort of technical and procedural systems in place to mitigate and respond to those users who are actually at risk of, maybe more severe harm, that's really significant. And that's really concerning because there is so much excitement about this new medium.
Wow, thanks, Isabel. I think that, leads very nicely into our next question that I have for Patrick. So we've just heard a lot about the chatbots and their ability to connect and also to inform and engage adolescents. But I can't help but wonder, Patrick, if you feel that these Mhealth interventions will ever replace in-person services for adolescents.
I don't think that the digital tools will ever replace care, but I think we can also think about this in more of a tailored or faceted approach, because in the U.S., one of the issues that we come across is that young sexual and gender minority people living in rural areas may have very poor access. There may be one clinic in town, and the receptionist in that clinic might be their aunt or their neighbor. And so, especially for sexual and gender minority young people, having this outlet to get some of those services and some of the counseling and some of the specific information through a digital platform may be a critical lifeline. I mentioned that increasingly we're using mail-out test kits for STI tests, for example, so that the relevant anatomical sites could be tested in people who don't have safe or proximate access to those services. On the other hand, I think we can think about this as a tool to optimize care. So if someone presents for care at an in-person setting, we might recommend for a young MSM, for example, that he should be screened for HIV 2 or 3 times a year. And many young people are unlikely to come back in at that frequency. So I think these digital tools can also offer the opportunity for reminders, for counseling, for mail-out commodities to help up that quality of care, even for people who may have proximate access to it. And finally, I would just say that I think the work that is moving into peer navigation really offers the opportunity to provide services, but also have a mechanism to refer young people on in to in-person services when a certain threshold is reached. And so it may be that for some people, that sort of peer delivered, app delivered, navigation is what they need most of the time, but at critical points, they might be referred in for a different kind of in-person care. And I think it just comes back to the idea of tailoring and reaching as many people with the basic services as we can through these tools, but also being able to identify and refer out the individuals who may need some more personalized care. And I think Isabel spoke to this, nicely as well. Like, do we have the mechanisms to make those linkages onward to in-person care when it's needed?
Great. So really complementing each other, right? The in-person and the digital platforms. Wonderful. So next, Bolatifi, I haven't forgotten about you. No doubt you think that we are far off digital solutions taking over in-person services. Your organization advocates for digital inclusion, and we'd love to hear a bit more about how we move towards digital inclusion, what this means, and why it's so important. Thank you.
Thank you for the question. I would say digital inclusion refers to activities that are necessary to ensure that we have disadvantaged people and people who necessarily do not have access to information and communication technology able to access and use these information technology tools. Now, in my definition, we see 2 important things, which is access and use. Access and use of information technology as both individuals and also for communities. So digital inclusion actually focuses on these 2 aspects, access and use. And so when we look at that, there are some elements that come into access and use, which includes affordable and robust broadband access. And also, we have the importance of digital literacy in communities. And also, we need an evolution of technical support. So I think this is what digital inclusion is focused on. And then I believe that as technology improves, digital inclusion also needs to improve with technology, because with new technologies, we need new understanding of these technologies and how they can be put to use. Yes, so with that, I submit. Thank you very much, moderator.
So a real powerful reminder there, the importance of including people, not just in terms of access to mobile phones, but also in terms of language and particularly those who are living with disabilities, making sure they are included as well. Thank you. So if digital platforms are going to be the solution to complement our services to help us to reach more young people, we really do need to think more about that inclusion. I know, Leah, at Triggerize, you are continuing to kind of scale up interventions, right? Scale up and reach as many adolescents and young people, particularly young girls, as possible. I wonder if you could share with us some of the lessons that you have learned along the way from your implementation. So, for example, how are you tackling greater inclusion and any other lessons you have to share with us today?
Okay, so first off, the platform is free to use by participating actors. We do not charge any membership fees. Funders subsidize the platform's running costs as a way to buy the impact generated by the platform. So in regards to inclusion, we have given quite a number of options in regards to demand generation and awareness around our platform. We do have above the line marketing campaigns that we carry out on our social media platforms to create awareness around the platform. However, what we have seen work is more direct on-ground support through assisted mobilization, which has led to an 83% conversion of the clients who get enrolled on the platform. We see that because our platform is serving 74% of the clients are below the ages of 17 years. Those actually do require a lot of hand-holding and information that is provided through the trained mobilizers that are enrolled on the platform to give them messages and also demystify the myths and misconceptions they have. We have also introduced quite a number of incentives that we do provide, and the incentives have also enabled repeat and continuous use of the platform. We have additional offers that we provide, such as sanitary towels for those clients who come in for the services, or HIV self-testing kits that have also enabled repeat use of services by the girls that are also coming on the platform. The use of nudge messages has also seen an increase in peer referrals of satisfied clients. We have also supported the service providers who also are supporting with the nudge messages by having the call center also conduct follow-up reminders and also checks onto the girls who've already received services on the platform. And we've seen a month-on-month increase in repeat use of the platform. Actually, from the month of January, we were at 12% in regards to repeat use. And as of June, we were at 37%. So we do know that additional support through the call center and also the nudges and the messages are actually working to increase participation on the platform. I had mentioned that we have 3/4 of the girls who have phones providing us with feedback through rating on the platform. However, based on the fact that 74% of our girls do not have phones, we have introduced client exit interviews, and this also provide an opportunity for these girls to give us their feedback that then enables us improve both the services at the facility, but also enables us give insights. It provides us insights on which we can be able to improve the platform, which additional offers we need to consider in order for us to better meet their needs. Yeah.
Great. Thanks, Leah. Some real practical considerations and steps that you have taken there. Thank you. Isabel, it'd be really great to hear from some advice from you around safeguarding that you might have for programmers who might be online today in the audience. So as we are expanding our digital spaces, including more adolescents, and especially in the use of chat box, what guidance do you have for us around safeguarding?
In a nutshell, as a chatbot practitioner who kind of really cares about what you can do to boost the safety of your service, there's kind of three key elements. So the first one goes back to this idea I mentioned in the previous question, which is really about the user journey and how you manage people's expectations of what kind of service they're likely to get and what can and can't be provided in terms of support. So, for example, something very small, like really making it clear that it's an automated service when they start using it, finding out through working with young people directly, what is their concept of chatbots? What is their concept of an automation? What vocabulary do they use to describe it? In Nigeria, for example, people use the term chat box, and they use that kind of quite fluently, and a lot of people with sort of, decent digital literacy are comfortable with that. In other countries, people might use different terminology, or they might have no familiarity with the format. So it's really important to kind of get that right and really flag up front the nature of the service. And also, once you've done that, make it really clear how they might actually access human-led services or talk to a real person on the team if that's something that your team can actually provide. The second thing, and again, this is, I think, the part that in a way is most challenging, and sometimes this is where practitioners may decide that they can't go down this route, that there is, something we have to acknowledge, which is that if you are in a urban area, the facilities and services that you might be able to access, notwithstanding all sorts of barriers around access, some of which Patrick mentioned, are likely to be kind of more available. But that's obviously not the case in more rural areas, or sometimes services are open for a year and then closed down. So it's still nonetheless really important to really do your research as a practitioner, whether or not you're a safeguarding expert per se, on what human-led services are available in the event that a user discloses a very serious risk of harm. So, for example, one of the countries that we piloted the Safer Chatbots mechanisms with, which is Europort, Uganda, they're really fortunate that they have actually got a quite solid national hotline service in the form of Sauti Child Helpline. So although they can't provide direct support for every single service and every single issue out there, they can provide fantastic kind of, knock-on referrals basically to more appropriate local services, and do actual kind of case management, and it's all via toll-free number. So it's really important that even though you might not be able to guarantee taking care and case management for that young person who's come to you with that serious issue, do make sure that you have at least one, service that you can provide, that you have done your research on what that service does and doesn't provide, that as much as possible you've actually vetted them to make sure that they offer the services they promise, that they're available at the times that they advertise, for example, but obviously to as much as possible build a relationship with them to make it clear that you will be signposting to their service and whether that's okay with them. And finally, and this is kind of the more technical element, and again, this can put some practitioners off because they may have the misapprehension that it would involve investing in something more complex in the form of artificial intelligence. But with Safer Chatbots, what we're recommending is that whatever the sophistication of your chatbot, you can still invest in a sort of really simple measure of automated detection and response to prioritize safeguarding related words. So that could be as simple as one single emergency keyword that you communicate to users at the start of the intervention. The example we always use, which is kind of universally understood, at least in English-speaking countries, is something like SOS. But obviously, we've had a great time working with users in our pilot countries, coming up with keywords that are sort of secret, private, known to young people that they can use to trigger a safeguarding response. And also to identify common words. I mean, I always use the word suicide or rape in my examples, but those are actually very poor examples because they don't reflect necessarily the vocabulary that a young person might use to disclose something that serious or private. So identifying what those individual words are triggering a system which says, based on what you've said, it looks like you might need some help. And if the user acknowledges that, yes, they are in a very difficult and potentially dangerous situation, making sure that you have crafted a really empathetic human response to that user in an automated fashion, and then giving them the option of accessing service information. Obviously, this is an imperfect solution. We acknowledge this, but we kind of take the philosophy with the Safer Chatbots project that this, something is better than nothing when it comes to safeguarding, and it's a great starting point.
Thank you. So digital platforms are really going to be a solution for reaching more young people. We really need to be doing more to improve access and use. Thank you for that. So Olatifa, over to you now for some advice. What can we each be doing to really play a role in encouraging and supporting digital inclusion for adolescents and young people?
Thank you very much for that question. I think it's always important to know what actionable steps can be taken, especially for adolescents and young people who are interested in actually moving forward and doing things that would impact positively the community. So I think, first of all, I have a couple of recommendations here, but first of all, I would say that we need to encourage participation and collaboration in internet policy. So as a young person, we expect that, or it's important that you join policy discussion. Now, how can you join this? There are lots of internet governance forums that happen regionally, locally. So take some time, just go online and check for Internet Governance Forum. It's a multi-stakeholder event, and it can bring in participation of people from diverse backgrounds. The next one is to encourage universal acceptance in everything you do. A lot of young people, a lot of us are developers, a lot of us are designers. We need to start thinking inclusion whenever we are designing new applications and online content. So this is what universal acceptance is all about. Let's build technologies that are more inclusive, that would not recognize other people's language as gibberish or as things that cannot be tenable, so that they also can be integrated into this internet ecosystem. Then also we need to create more programs and policies that address all the aspects of digital divide. Yes, and I mean this includes digital divide for women, for people in underserved communities, also for the disabled and for other underrepresented folks. So it's important that we address this divides through policies and programs. And also we need affordable and subsidized broadband services. As young people, we can always advocate for this. Government need to see that the internet is no more just a luxury, but now it has become a necessity. The COVID-19 pandemic has shown us that a lot depends on the internet right now, from schooling to survival, ordering things in lockdowns and all of that. And we realize that this has become a critical resource that can determine the livelihood of people around the world. So it's important to advocate for an affordable and subsidized broadband service for people all around the world. And then lastly, which I would always stress, is collaborations. We need collaboration in all sectors. And that's why I love the multi-stakeholder method that is used in the Internet Governance Forums. Entities that provide local digital inclusion services, policymakers, advocates, social service providers, and community leaders need to co-create solutions in partnership also with the community and young people like yourself and myself. And we need to work together to ensure that the digital space that we have today is as inclusive as it can be.
Fantastic. Thank you all for this wonderful start to further discussion with our audience.